In this lecture, we will discuss De Winter sign, including its EKG features and clinical significance. Large T waves can occur in multiple conditions, including myocardial ischemia, hyperkalemia, early repolarization, as well as male-female pattern. In general, T waves should not exceed 5 millimeters in the limb leads and 10 millimeters in the precordial leads. So T waves with a greater amplitude are considered large, okay? Now, with hyperkalemia, these large T waves often have a narrow base. However, with myocardial ischemia, these large symmetric T waves have a broad base, okay? They occur almost immediately following complete coronary artery occlusion and will typically resolve within minutes, and hence the name we call them hyperacute T waves. The ST segment elevation occurs after they disappear. So remember, these hyperacute T waves, as you see here, so imagine this is our hyperacute T waves, they'll be present with no ST segment changes, okay? So imagine you have a complex here, and then you have these hyperacute T waves, okay? And then eventually with it, so that occurs right when you have occlusion, okay? So you have occlusion of a coronary artery, and then after that, so imagine this is blocked here, you'll have these occurring within seconds after, they last a few minutes, and then they start to go away, and that's when we start to see these ST segment changes, okay? And you can think of these hyperacute T waves as the first EKG change in a STEMI, or ST elevation MI. And because they don't last long, remember, these aren't commonly seen in clinical practice. But what if hyperacute T waves did persist longer and even for hours? Well, this is something we call De Winter sign, or sometimes referred to as persistent hyperacute T wave syndrome. These hyperacute T waves are accompanied by ST depression with upsloping ST segment, and they are 1 to 3 millimeters deep of the ST depression, and we want to see them in the precordial leads V1 through V6. You may also see slight ST elevation of greater than 0.5 millimeters in AVR. Okay, so let's look at that associated ST depression. Here's V1 through V6. Okay, so now we have these hyperacute T waves that are supposed to go down, but they don't. Instead, they stay up, and now we have starting to develop the ST deviation, okay? And we have upsloping ST segment, okay? So notice our ST segment is upsloping, and there's depression, okay? Imagine we had a P wave here. This is our PR segment used as our baseline, so we are below, okay? And we said the ST depression should be upsloping and between 1 and 3 millimeters deep, okay? And we can obviously see that here. It's almost 2 millimeters deep, okay? And again, so upsloping ST depression, 1 to 3 millimeters deep, hyperacute T waves in V1 through V6, okay? And you may see slight ST elevation in lead AVR of at least 0.5 millimeters. That's sometimes present as well, okay? Now, this is a sign of acute proximal occlusion of the left anterior descending artery, or LAD. It is pretty much an anterior STEMI equivalent without the ST elevation. So don't forget De Winter sign, which again is persistent hyperacute T waves associated with upsloping ST depression in the precordial leads, okay, as this potential sign of proximal LAD occlusion. All right, let's review what we discussed before we end. So De Winter sign, also sometimes referred to as this persistent hyperacute T wave syndrome, okay? Remember, we define large T waves that are greater than 5 millimeters in the limb leads and greater than 10 millimeters in the precordial leads, okay? Now with these hyperacute T waves, they're large, symmetric, they have that broad base, okay, that differentiates them from the narrow base found in hyperkalemia. They appear within seconds after occlusion, and they're often short-lived, okay? However, that's not the case here. We have persistent hyperacute T waves in this De Winter sign, okay, as well as upsloping ST depression, okay? So we had the ST depression, and again, it's sloping upwards there, okay? In the precordial leads, V1 through V6, we said sometimes you'll see a slight ST elevation of 0.5 millimeters or greater than that in AVR. And remember, the clinical significance of this is that it's pretty much an anterior STEMI equivalent without the ST elevation, okay? We're seeing ST depression with these hyperacute T waves, and it could be a sign of acute proximal LAD occlusion, so something you want to take care of and treat quickly. Well, that's the end of this lecture. We discussed De Winter sign, including its EKG features and clinical significance. I hope you learned something.